Hello, everyone. Welcome to our Facebook Live. And we have our live patients present with us today. And we have our incredible online community. And I want to welcome you all. Happy New Year. And this is going to be an amazing year in health. And I'll tell you why. My mission is to now reach 1,000,000,001 people, to tell them the secrets of health. Because all of you know that no one wants you to know how to save yourself, to actually save yourself, and you can. And you're talking to someone who didn't come into the world with a clean slate, with a perfectly functioning body. As some of you may or may not know, over 60 years ago, I was born, and my parents received a letter when I was 16 years of age telling my parents that the drug my mother took caused cancer in both male and female offspring. And so I had to go to MD Anderson, and you know, if any one of you know anything about MD Anderson, it's probably the most sought after cancer institution in the world. At that time it was, and at this time it still is. And I was 16 at that time. I didn't even go to the doctor, because back then you didn't really go to the doctor to get any checkup. Nobody was sick. And here we are in this maze of halls. And I was like, whoa, where am I? Like, what am I doing here? Like, this is scary. And MD Anderson's it's a teaching hospital. And so not only do they have the doctor, they have the entire team. And, you know, getting a female exam is not something you do at 16 years of age. So here my body was being invaded upon, along with the entire team of people examining me. And that's how I learned about cancer. So that was a long, long time ago. And of course, as time has gone by, I went to School of Public Health, and I got my master's degree in public health and writing my final thesis on the drug that my mother took. And then I went to medical school. Fortunately, I was able to go to medical school and learn how the body really worked. And then after medical school and after training, I started seeing patients like regular conventional doctor. But I wasn't conventional from the beginning. I was a little different, because I was taught from my mother that what you eat really matters. Now, she wasn't a tree hugger hippie or anything like that, but she just knew that she needed to make the food, and she needed to grow the food, and she knew that we needed to eat at home, and we didn't go out and eat fast food. And so my whole mission in life is how not to get cancer. And I want the world to know what I know. And my patients here today, and the patients out there listening, we have and we know the cure for cancer, and its prevention. We are living in cataclysmic times. Over 1,600 people die a day of cancer. 1 out of 2 men and 41% of females. And not one word is spoken about it. How can that be? Nixon declared war on cancer in 1970, and the survival rates are the same as they were in 1970. And the amount of people getting cancer has dramatically increased, and not one word is said, except by the patients that I see. And the people out there on Facebook Live listening right now, they know and want to know more. And it is all of our job here to become ambassadors of health. Because without health, there is no life. And the last time I looked on Amazon or Walmart, you can't go and get a new body part are a cure for cancer. It begins with me and you. Mother Teresa said, we all belong together. And if you are ill, it indirectly or directly affects me. It affects your family. It affects your work. It affects society. It affects the entire world. And we do not have to be sick. We do not have to be in agony. And if by chance you get diagnosed with cancer, every week, every month, we are learning something new. Science is changing every second by the second, every minute by the minute, every day by the day. So there's something new if the doctor, the researcher, the practitioner is constantly researching all the invincible possibilities to help their patients. And that's what we do now, every single day. And our patients know that. That's why they come here, because we're constantly on a quest to learn something new on how to take care of our patients. The conventional treatment of surgery, chemo, and radiation, which is what is out there for all patients, it may or may not be needed. But if it is needed, there is extreme preparation, even for a biopsy, even for a surgery, even for chemotherapy, and even for radiation. Is your doctor preparing you for a biopsy? And he'll say, or she will say, oh, it's no big deal. It's a big deal. It is a big deal. Don't let anyone tell you that you're not a big deal, because you are. I'm telling you, you are. I have studied the magic and the miracle of the human mind and body, and every day I'm in awe. I'm in awe. So I want you to be in awe and share the experience of the miracle of the body. So I'm asking you today, tonight, wherever you are, whomever you know, to share this message to the world, because we have a responsibility to ourselves and to our fellow man to save this world. Health is the foundation for everything in your entire existence. And you will learn, listening regularly on these Facebook Lives and the information we put out and the continual research that we do, that you can change your life now. Never give up on yourself or anyone else. So I challenge you, please, to start right now with yourself and the care of your fellow man to change the cataclysmic decline of health in our world today. It's not just in the United States, it's literally all over the world. So with that introduction, I'm going to ask our online, we haven't forgot about you, our online people and our people that are here today.
Hey, Dr. Connealy, we have Susan. Please talk about any success with pancreatic cancer, please.
Okay, pancreatic cancer. So pancreatic cancer now is the 4th leading cause of death in this country now. Yes. And the reason why pancreatic cancer is so elevated is a couple of reasons. One, your pancreas sits here, right here, and it's a beautiful velvety organ. When I say velvety, the covering of the pancreas is not hard like the liver and the kidney. It's very, very soft. So that makes it very vulnerable to toxicity. Don't let anyone tell you that we're not living in toxins. I know that's a double negative. But we are living in the most toxic times that we could ever imagine. Purification, detoxification is not optional. It's absolutely mandatory. The other thing is we have pre-diabetes and diabetes. About 80% of the population is suffering from pre-diabetes and or diabetes. So pre-diabetes is you have a sugar problem, but it hasn't become diabetic. Then we have obesity. We have overweight and obesity, which is about probably 80% of the population, and all cancers are contributed from being overweight or obese. It is not an issue of beauty and aesthetics. It is a thing that it is critical to your health that you have the proper body mass index and the proper weight. So pancreatic cancer, like any cancer, any disease, there's not one cause to any diseases, there's many causes. So of course with each patient here, we take a very systematic approach, which is, what is your stress? If you are in stress mode 24/7, it will be impossible to heal because we have something called our nervous system, and our nervous system has a parasympathetic, sympathetic mode. When we're in sympathetic mode, we're like that all the time, you know? So do you think you're gonna hear, or you can hear anybody, much less heal? No, you're not. So that's the first and foremost thing for everybody listening out there. I'm a patient too, so don't think that I'm exempt from any of this. I have to live the same life that you do, okay? And I've had to learn, just like each person here, and my road has been very, 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 very long, and we will not get into that right now, but it's been very long, okay? And had lots of challenges, but we cannot live in fear and stress because we will not get well. So that's why I always say that emotional work is the most important thing that we do. And it doesn't have to be with just us. You could just do deep breathing, okay? You could just do deep breathing every day. Take 3 times. You could do it anywhere, anyhow, cost no money. That puts your body in parasympathetic, which is calming, healing, receiving. So please, everyone, do 10 deep breaths into your abdomen and out 3 times a day. I'll teach you a little technique later that you could do every day by yourself. Costs no money, costs no energy. It's very quick, and it will change your life. So please, that's the first thing. Second thing is you must go on a specific, very specific eating program when you have pancreatic cancer. Number 3, which is mostly ketogenic, and the reason is ketogenic, which is the most visited dietary intake program in 2018. And it's not the diet for everyone though, don't get me wrong. There is no one size fits all for any person. So if you're not doing ketogenic, do not worry, it is not the only eating program that is available for man, but that is the one particularly for pancreatic cancer. Then, pancreatic enzymes. If you look at Professor John Beard, who did the study with pancreatic enzymes 100 years ago, he talked about pancreatic enzymes. Pancreatic enzymes clean up inflammation and garbage and take off the coating of the cancer cell. Very, very important in patients with pancreatic cancer. Then, depending on the patient, we may need to do mistletoe, which has been used for over 100 years. It's made from the mistletoe plant. It has over 2,000 clinical PubMed studies on mistletoe. There's 42 active clinical trials going on right now. Don't let anyone tell you it's not real. It is real. And mistletoe is magical. Well, it's magical, you know, when you kiss under it, right? So then on top of that, it is, what it does is it absolutely makes you feel so much better. Could it be, you have more energy. I had a patient, so it's a tennis player, and he goes, my teacher's like, what are you taking now? You have boundless energy. The guy has 2 kinds of cancer, head and neck cancer and prostate cancer. He's like, what happened to you? You know, just going on mistletoe had boundless energy. and could hit the ball better than he'd hit. And he's 72 years old, so figure that. Anyway, it decreases metastasis, decreases vascularization to the cancer, all these wonderful things. And I just read, interestingly, last weekend when I was doing my research, because I'm always, if anyone's to know, I'm an information junkie, and I am constantly reading or talking to someone because I love it. Anyway, it was telling me, I read this whole thing about the history of mistletoe, but he was saying that we should be using it longer than how we were utilizing it in our clinic. So I was like, oh, so I guess I need to revisit this whole mistletoe thing and how we are prescribing it to our patients. Now, some patients here, as I mentioned earlier about low-dose chemo, you can do low-dose chemo, and I recommend low-dose chemo because some of my patients, I had a patient that came in last week and told me that I take care of the grandmother that's 94, the daughter of the mother, and then the granddaughter of the 94-year-old. And I've been taking care of them for like over 20 years. And they see me regularly, and one has breast cancer, another one has diabetes, and the 94-year-old is just doing like amazing. And so she can take care of all three, believe it or not. But anyway, we were talking about her. They wanted to send their uncle to come in and see me, and he goes, well, no, I'm going to just stick with my oncologist and do chemotherapy. So one of the family members said, well, shouldn't he be taking something for his immune system while he's going to get this chemo? And he goes, no, he can handle it. Well, he died after one chemo.
Oh, no.
Yes. And now this is not the first time I've heard this. Okay. So there's so much coming out about chemotherapy. Chemotherapy is very, very, very serious. That's why we only do low-dose chemotherapy, and we do low dose in a very special way. Then you may need, you have to do purification. So we do saunas, and we do baths, and we do coffee enemas, all different things. So if pancreatic cancer is caught earlier, it will be much easier to take care of. If you just do conventional therapy for whatever cancer, you do not do as well. Like I said, you need to prepare the patient even for a biopsy. Some of my patients opt out of not getting biopsies because they know the potential of seeding when it comes to cancers, especially prostate cancer. So always never do anything out of emergency, because out of emergency you're in fear and you're scared, and so you don't heal and you create problems. Number 2, do your homework. Talk to friends. Start researching. You're going to tell me there's a lot to research, and I'm going to tell you yes, and there's always going to be a lot to research. And if there are many websites that say the same thing, it must be partially true. And then always have an advocate. Always have someone with you. There's now the third leading cause of our death in this country are medical errors. So please make sure that your doctor and your caretaker really care about you and know what they're doing. And if they're giving you a chemical, you better know all the things that chemical does. Because you know what I was doing last night? I was watching television, which is unusual for me. And I was watching the ads. And they would have 2 ads in a row of the attorney firm that's going to sue the drug company. I'm like, in a row. And I'm like, and then the next ad was an ad for a pharmaceutical drug. And I'm like, what? Wait, you're advertising for the drug, but the next commercial is the law firm that's going to sue the people. I'm like, wait a second, this is crazy making. You have to start questioning what you're doing. And you can't just take it like, oh, my doctor told me to take it. Doctors don't know everything. I don't know everything. I just know that drugs have very serious potential downside, and you are not like anyone else, so you don't know how it's going to respond. So don't be the guinea pig for some new drug that you don't know what it's going to do. I was a guinea pig. Look what it did to me. Now, you can't tell what it can do to me looking on the camera right now, but I'm going to tell you, we could go on for the next 18 hours what it did to me, and I still have the issues. So please go to the doctor with somebody. Do your research. Don't jump into anything. Science, like I said, is changing by the second. I learn something new all the time. Don't just, take this person and then think, what are the consequences of this long-term, irreversible decision? What are the consequences? Because there are consequences a lot of times, and there's an incredible documentary out on this. If you want to, it's on Netflix, I think it is, Netflix, called Bled Out. HBO, but anyway, it's something that tells you what I'm talking about right now. The patient went in for routine hip surgery, and the patient's a vegetable now from routine hip surgery because she didn't have an advocate, or she did have an advocate, and they went along with the authority of the doctors. And I'm not saying doctors aren't smart. They're very, very smart, but they're human beings like all of us. And we got to be careful with each person and make sure we're making the right decisions. And so I'm giving you caution, because that's what you need to be doing. Is this is your body. You only get one of these, and you can't go get replacement parts anywhere on the planet. And we've got to take care of ourselves.
So I think you already talked about breast biopsies.
Yeah, what was the question?
Okay, can you talk about how breast biopsies may not be the best idea? I think you covered that.
I did talk about that before.
Okay, so I'm going to go to the next question.
Okay.
You have a lot.
Okay.
Is there any good supplements or treatments and advancements for CLL leukemia?
Yeah, CLL. So CLL is a cancer that's actually very easy to treat with low-dose chemotherapy. But let me tell you, whatever cancer you have, it doesn't matter the label. There are multiple facets that, if you read in my book, The Cancer Revolution, I really call it, it's a foundational book for any disease process. It doesn't matter what illness you have, it would be applicable. Would you agree?
Yeah.
Yeah, it'd be applicable. One of our patients is here tonight, and she works at a very well-known health food or health line, and it can be utilized for any disease process. And so, because I address everything in that book, and it's life is just not that simple. Disease takes many, many, many years to happen. So if you have a heart attack, that heart attack started somewhere between 10 and 20 years ago. So you think one little surgery, one little stent fixes it? Do you think just having a little lumpectomy is going to fix that 10-year-old lump? No, no, and no. It's not that simple. So we must address all the facets of this magnificent miracle to heal it. But we need to put it in the correct direction so that it does heal. We've got to turn on the inner doctor within each one of us that heals our mind and body. Do you guys agree? Yes. Okay.
What does RGCC testing offer me?
Okay, so she's talking, her question was, what does RGCC offer? So RGCC is the laboratory in Greece that we use at this clinic. And the lab is located in Greece because the doctor, Dr. Pepitsaru, is an MD, PhD from originally born in Germany, but he resides in Greece because he's Greek and he has his babies there and his mom and dad are there. So he needs someone while he's traveling 100 hours a week, literally, and speaking everywhere, he needs someone to take care of the home. And so RGCC testing is the most sophisticated testing that you could get available in the world today, okay? It tests for circulating tumor cells. So circulating tumor cells are the wannabe cancer cells. So circulating tumor cells can be present without a lump, without an MRI, PET scan, CT scan, ultrasound, or a scan, that there can be no bumps and a person can have circulating tumor cells. So I would say it is a great biopsy for if you wanted to know if you had cancer. It's a great way to get a biopsy of your blood and see if cancer could be brewing, simmering, or fermenting in the body. The other thing it tests is it tests all the chemo if someone were to have cancer and they needed to know what specifically chemo worked on the cancer. It would tell me all the different chemos. Then it would tell me all the drugs, the small molecular weight molecules, the anti-estrogen molecules, all different kind of new chemicals that we have that could potentially thwart one of the growth factors of the cancer cell. Then it tells me all the growth factors of the cancer cell. So cancer, I always compare cancer to this. It's 100 leaks in the roof. It's a rainstorm, tornado, and hurricane from Texas, and you're trying to seal them all off at the same time. That's cancer. Is that simple?
What about my dental health? I have root canals.
Oh, dental health. Well, in the United States, people don't believe that your mouth is connected to your body. Is it? Yes, thank you. It is. The last time I looked, it is. Well, in medical school, we do not learn really anything about teeth or the mouth. I'll be honest, really nothing. I have learned all my education about the teeth, I would say mostly in the last, I'd say 15 years. All right? Before that, I will tell you I did not put that much value on the teeth. Well, now, what I know now, and in Europe, like in Switzerland or Germany, the first thing they do is they examine your mouth, and I'm not just talking looking at it, and they examine your gums, and then they look at do you have root canals? Do you have any kind of metal in your mouth? Do you have whatever? They do a full, and that's the first thing they do. Before they fix anything, that's the first thing they do. In almost all disease processes. So here we have drill and fill. That happens like that, but that's not the way it works. First of all, your mouth is the gateway to the rest of the body. So not only cancer, but heart disease. Probably heart disease and cancer, about 90% are related to our mouth. So our mouths need to be pristine. And what does that mean when you say pristine? Obviously no cavities, no fillings. Like I had mercury fillings. All of you in this room probably had mercury fillings because that's what the dentist gave, was mercury fillings, right? And they thought mercury's okay, right? Well, we all know, is mercury okay? No, mercury's not okay. And if you want to know, I will send you scientific facts on mercury. Email us and we will send it out to you. You need to know mercury is outrageously toxic and very, very, very serious. So that, number one. Number two, if you have a root canal is a simmering infection. It tells people it's like a diabetic ulcer in the mouth. So if you've got a diabetic ulcer on your toe, would you just like let it go and let it be? No, you go to the doctor and say why, where, when, and how, right? Every doctor should be asking why, where, when, and how. And then he would say, we have to fix this. This is very serious. It can kill you, right? Correct? Right. So why aren't they saying that same thing about your mouth? Why? Like, we know this knowledge is out there. You can Google anything if you want to know. Anything I say, it's not I'm a genius. It's just I read and study all the time. So that. Then we have cavities, which you can correct with simple little butter oil capsules with raw cod liver oil all in one. Take a whole bunch of those. That's why butter is your friend, because butter is loaded with all the nutrients for your teeth, believe it or not. And then we have bad gums, which are a chronic infection. So that's why oil pulling and brushing your teeth with special toothpaste, like here we have clay toothpaste, I have silver, I have different kind of toothpaste that automatically cleanses your mouth on a regular basis. So yes, every one of your teeth will correspond. In fact, last night I was reading a doctor in Germany. I was reading a case study. The patient didn't have cancer. All they had, guess what? Recurrent urinary tract infections. which I was interested because I have some patients that usually my tricks work, but I thought, okay, I can always learn something new. So here he is telling me everything he did with the teeth, and I'm like, oh my God, and he tells me the whole thing, how it worked, and I was like, oh, I need to step up my game a little more. So it's amazing how the teeth, but you have to work with a dentist that, one, understands this, two, they call them biological dentists. They're biological because they're constantly learning. They're constantly learning things, and they just don't drill and fill and get you out the door.
I've been diagnosed with breast cancer. My doctor said I will not survive unless I have a mastectomy. Question mark.
Really? So I don't know the details of this particular patient. She wants to know if she will die without a mastectomy. Well, I don't know if that's something we learn in medical school or training, because there is online, there are a list of miraculous healing patients that all of us could be one of, right? And then they say, oh, you didn't have cancer, or you didn't have X disease. So I don't know your situation, so I don't know how to give a clear answer because I don't know how big your mass is. What I would do is set up a specific consult with one of us to really understand, but I do know that lumpectomy or mastectomy, the survival rates are the same if you get a lumpectomy, but I don't know the size of your cancer. I don't know a lot of specifics. Is your cancer only in the breast? So it's a broad question for me to give but again, please do not allow doctors to scare you. That is not a course that we take in medical school or training, how to scare patients into treatment. Or another thing I didn't learn is how to give an expiration date.
Is cancer genetic? My sister has the gene. Will I get it?
Oh, that's a great question. So is cancer genetic? Very little, probably less than 5%. We do genetic saliva testing. Since your sister has genetic positive BRCA1 or 2 probably, you should definitely get tested. And that does not mean, though, genetics is not destiny. And more importantly, today, every single person needs to be checked to see if they have cancer. And it will be becoming more prolific with the introduction of 5G.
Okay. So everyone's saying, this is my doctor. They're sending you hugs and kisses, Dr.
Oh, thank you, guys.
So we have that one. And do you know of any treatments for stage 4 indolent follicular lymphoma?
Well, everyone always wants to know about their particular situation. It could be pancreatic, prostate, breast. In this case, it's follicular lymphoma. So it's stage 4, of course. There's lots of things that she can do. I don't know how old the patient is, but again, if she could start with...
It's a man.
John. Okay, John. Okay, if John, you can start, I don't know what your oncologist has said to you, but how old is John? John, how old are you?
Answer, John, if you can. I'm going to come find you.
This is fun. This is amazing technology, guys. We're talking to someone. He's in our circle today. Just think about that, and we're giving him hope. Right? It's fabulous. 61. Okay, thanks. Anyway, so he's 61. So yes, there's lots of things. I would send your blood off to Greece to do the RGCC testing to see what maybe do a little low dose chemo, maybe IV vitamin C, depending on how the RGCC testing came out. I might consider some mistletoe, some salicinium. Definitely put you on a purification plan. How is your eating? What are your vitamin D levels? How much vitamin C are you taking? All of these things, of course, again, there's lots of people live a very, very, very long time and checkmate with cancer all the time.
He's saying CTC count via RGCC is currently 4.2. Immune frame is done. Can we get an idea of what and where to go from here?
Sure, of course. So because he's asking for very specific things, I always tell people every one of us is a beautiful tapestry and everything matters. And so talking about things superficially really never works that well. I can talk about general things, but we really need to know like a lot of the specifics, a scan. Like one of my patients came in today and he has prostate cancer, and I know the man, and I said, but I can't make a decision which direction I'm gonna go until you get me the scan. He had the scan done at UCLA, but I said, I can't make a decision what we're gonna do today because I need the scan. So anyway, so even with the person I knew, I couldn't tell him which direction I'm gonna go, so.
What about parasites? Do they affect cancer?
Parasites, oh, lovely, lovely, lovely. Everybody knows about parasites? A little bit, yes. Parasites are real. They are one of the top 10 leading causes of death in the world. Do never underestimate their power. The worst case scenario I've ever heard about parasites, I read Discover magazine because they always have this, unusual clinical case. And the clinical case is that they were trying to figure out the mysterious case of these people in coma. You know what coma is, right? So they found out it was a parasite. So we think coma, like, we don't think parasites, do we? We think, is it diabetic coma? Is it, heavy metal toxicity? What is it, right? But it was parasites. So parasites are very, very resilient organisms. There's over 500 species. In the United States, doctors do not think that Americans have parasites. They're in the water supply. They're in the food supply. When you're traveling on airplanes, they are real. In the United States, their world lives here now. And some of the largest countries with parasites are India and China. And there is no accurate stool testing for parasites. So don't think that you could just go do a stool test, because is the stool test checking 500 parasites? No. Is the parasite alive by the time it arrives to the lab? No. So you must do bioenergetic testing of your meridians to see if parasites are prevailing in your body. And then there are a group of medications and or natural treatment. A lot of times we have to use medications to eradicate parasites. But I will have my patients, they will actually bring in their specimens to me, the beauty of being a doctor, and they bring in their specimens. And you can go online. One of my doctor friends that's in Seattle, in his office, he has formaldehyde containers of all different types of parasites to show to patients, yes, they are real, that you can have aliens called parasites in your body. So do not take them, they can't be happening, but it's all about the diagnosis. And if the doctor doesn't do acupuncture meridian testing or bioenergetic testing, he or she will not be able. There are occasionally stool tests that will pick up a parasite, but most of the time that will be insufficient testing. I know because I've had parasites, so I personally know.
What are the benefits of taurolidine shots? Lidine? Taurolidine?
Taurolidine?
Yes, then.
What are they using?
She's not saying what are the benefits. She's not putting it in context. So let's skip. If you, Heather, you want to put that in a context, I'll try to get that answered for you. Okay, Monique. So you wrote a little bit more, Monique, than we can see. So I'm just going to look for the next step after stage 2 triple negative breast cancer. Went through chemo and surgery, and it seems to me you might have done radiation. So wanted to know the next step.
Triple negative breast cancer, and she's done surgery and chemo?
Yes.
And what's her question?
She said looking for next steps.
Well, have you changed your mind? Have you changed your eating? Are you cleaning up your body? Have you checked out your vitamin levels? Checked. Did your doctor do RGCC, circulating tumor cell testing? Did you get, bioenergetic check for parasites and or other organisms and or other energetic blocks? So there's a lot she has to do. And she's got to heal from the surgery, and she's got to heal from the chemo.
Okay, and Monique, I recommend you buy Dr. Connealy's book. There's a lot of information in there. Linda, what causes metals in our blood chemistry?
So she asked what is causing metals, and it's not the heavy metal band. It is, there's heavy metals, mercury, lead, cadmium, arsenic, aluminum. Uranium now is present in a lot of people's blood and urine, and also gadolinium. If you've ever had an MRI scan, you have gadolinium in your stream, and it's not just bloodstream. What you not only want to know is not only what's in your bloodstream, what your body burden of heavy metals are. So the body burden is it's the body's, where it's residing in the tissue. So you have to do what they call a provocative test that spills out the urine and tells us what the body's burden of all those diseases. Heavy metals are in everything: air, water, food, shower water, everything, and more than ever. And it's even worse if you combine heavy metals with bugs. It enriches the environment for their survival more. So that is why constant purification and detoxification is mandatory for every single one of us. It's not just whoever's listening today, it's every one of us.
Okay, Havo, if I am cancer-free, should I continue IV vitamin C?
Absolutely. IV vitamin C is beautiful. But that's not the only thing she can do. So I don't want to mislead her that just doing vitamin C is the only thing she needs to do. There are many things. Vitamin C is very, very helpful.
This is Lynette. Her brother died of bioduct cancer. Is that inherited?
Well, as I said earlier, inherited diseases, you guys are it's less than 5%. So it's a very good chance that your cancer is not inherited. So bile duct cancer, the reason why we're getting so much more bile duct cancer than we've ever seen before. So where is the bile duct? Right up here in our right upper quadrant here. We have our liver, gallbladder, and the bile duct connects all of that. And so the bile duct is this little tube. And what happens is those chemicals or parasites or toxins or whatever, there's too much. And the body gets inflamed and causes inflammation and or infection, and then your body can't take care of itself. It's like your bathtub is overflowing with all the burdens, and that's why if you cleanse regularly all the time, it's a very good chance you won't get ill. That's one thing, it took me 30 years to learn that.
Okay, I'm going to keep going. We got a lot. We have about 10 more minutes, everyone online for Dr. Connealy, and then we will be scheduling another. We have a beautiful big event March 7th. Everybody can see her live again, so we will be sending out a notice. So everybody get on our email list for that. Let me get.
Does anyone have any?
What is the difference between Greece dendritics and the Mexico dendritics?
Oh, well, that's a very good question. First of all, if you don't know anything about dendritic cell vaccine, you should go, first of all, read on your own, because we don't have a lot of time to talk about all the details. But the dendritic cell vaccine is being done all over the world, but it's how you do it and how it's executed, and more importantly, how you prepare the body for the vaccine. Because the vaccine is to give you permanent immunity from that cancer. So let's say you have breast cancer. It gives you permanent immunity from that cancer. It kills circulating tumor cells, and it can kill existing tumor. Although that's not the most ideal candidate to give patients that have body burden of tumors, although it has been done and is being done. But dendritic cell vaccine, you should always check your immune system. So we do something called the immune frame that tells me the status of your cells in your body, your interleukins, which are inflammatory factors, your TNF alpha, your T cells, B cells. So it tells me what I need to fix. There's no sense in doing a dendritic cell vaccine unless your immune system is prepared to receive and utilize that vaccine, because that vaccine works over years. So the more optimal your body is, the better that vaccine is going to work. So I know that I see patients from all over, where so I see like different ways they do everything. Most people do, in fact, I don't think I've ever seen it. They don't look at the immune system first to fix and optimize the immune system, which is very sophisticated, and then cleanse the body up, mind up, everything, and then the dendritic cell vaccine is the last thing you do. So we can't just so if they are doing that, wherever you're going, that's great, but if they're not, I was in Germany, in Baden-Baden, a couple months ago, and I met a doctor who's been doing dendritic for like 20 years, and he didn't do any of that before, and I was like, well, how are you giving dendritic cell vaccine without properly preparing the body? Again, if you were gonna have facial plastic surgery, I would be telling you to prepare the body before you even get facial plastic surgery, right? Because you could die from those surgeries. So why wouldn't you prepare the body? So it doesn't make sense to me. So it just doesn't make any sense to me that we doctors are not preparing the person's mind and body for whatever invasion is going to take place.
We have a lot. I'm just going to try to pick where I can. A friend is starting radiation on voice box. What can he do to help with the side effects? Stage 2.
He's getting what now?
Starting
radiation.
on a voice box.
Okay, so, whoa, that's very, very serious, okay, because, right, I mean, it's a very head and neck cancers. First of all, you want to know that head and neck cancers, over 40% of them are caused from HPV. So if you do the surgery, chemo, and radiation, and you have not addressed the HPV, which is human papilloma virus, which is common in probably 80% of 25-year-olds today, that means that you're not going to kill the cancer because you didn't address the main cause of head and neck cancers, right? So if the doctor hasn't done an HPV on the biopsy and then is there a drug for HPV? No. So how could he be treating it unless he's a biological integrative doctor that is addressing his whole body? We're into whole body healthcare. You can't take care of a sore knee without taking care of everything else, right? Just makes sense, right? So if he's going to get radiation, and this is a common, very, very, very common question, radiation is carcinogenic, correct? Is cancer causing? What makes radiation work great? Hyperbaric oxygen. So the patient should always be getting hyperbaric oxygen with radiation if they're going to do radiation. The other thing I do is I have patients always take something called SOD, superoxide dismutase, which is a supplement that will help counteract the damaging effects of radiation, which can last for months and months and months. The other thing I have the patients do is active hydrogen. Hydrogen neutralizes these unwanted chemicals that are constantly in our body. So we have to do all of these things. Please do not, and you need to be on high doses of vitamin C. I would do Vitality C, a teaspoon twice a day. The superoxide dismutase, SOD, I would be doing 3 times a day. But this, again, I will tell you, it is not simple. So it sounds like he's already had radical treatment, but have you addressed the origin of this problem and the contributing factors to what is going on?
Okay, so Heather, you're still not clear. What you could do is email info@cfnmedicine.com and we'll try to get that answered for you, because you're out of context on what it's for. So then the next one is, how effective is SOT therapy?
So the question is SOT therapy. So SOT is supportive oligonucleotide technique. And that is a technique where they take the circulating tumor cells, they reverse engineer a new messenger RNA, and that messenger RNA disrupts the DNA of the cancer cell. If you look online, antisense, just look up antisense. There's a great infographic of how the train track is derailed. And SOT we've been doing for 5.5 years. I would say it's successful over the 95% of the time. It is to get rid of and terminate circulating tumor cells. Now, why are circulating tumor cells important? They're important because they are responsible for 95% of metastasis. And so when you've had cancer before, or let's say you don't even know if you have cancer and you have circulating tumor cells, those little critters are the critters, the wannabe cancer cells that are responsible for finding a new home, nest, or residence in the person's body. Yes, natural things work on circulating tumor cell, but they may not be 100% effective. If you do surgery, if you do chemo, if you do radiation, or any combination thereof, it will not eradicate circulating tumor cells. So we use a combination of natural therapies depending on how your testing comes out. We find the best agents to work on that patient's circulating tumor cell. And then we will add the SOT. We do not do SOT on patients who have tumor burden. When I say tumor burden, let's say a patient has a breast lump that's 2 centimeters or 4 centimeters. We do not do SOT. We shrink the tumor burden, whatever ways we need to do it, and then we are left with the circulating tumor cells, and then we go after the circulating tumor cell by changing the body's environment and creating an anti-cancer environment that you'll find in my book, and then we will do either a combination of natural substances that are specifically for you, and then add the SOT. The SOT is given back as 1 IV. That IV lasts for 4.5 to 5 months, and then we decide if you need another one. So yes, it's very, very successful. It's very specific to each patient. So I want to tell you how unique each of the people that are here listening here today, and every single person that is listening around the universe, you are all unique. We cannot have a one-size-fits-all approach. Yes, there's going to be some common denominators, but again, as unique as our fingerprint is, every single one of our cells is, and a cancer cell, each cancer cell, not to mention the billions you may have in your body, but each one is unique. So that makes it a very, very, we're in constant nanosecond playing chess with this very crazy, out of control organism.
Okay, Dr. C, we have one more. Hold on. Okay, we went over that. Some of them are, some of your questions online, gang, she's already answered, so we're going to post this when we're done. Let me go over lymph. Do you believe that lymph stagnation is an issue and needs to be detoxed?
That's a great question. In fact, I just sent my therapist last night, a whole another explanation of the lymphatic system. So people they forget, and doctors probably are the worst. The lymphatic system is one of the most unbelievable freeway systems in your body. And it is 4 times greater than your blood circulation. That's how much garbage we make if it's 4 times greater than our blood circulation. The rule of thumb I use is the blood delivers the groceries, the lymph removes the garbage. And so our lymph removes garbage all the time. So all of our patients, we love to give lymphatic therapy. First of all, the patients love it, but second of all, it's an invaluable treatment for not just cancer patients, all kinds of patients, heart patients, autoimmune patients, all kinds of patients. I love lymphatic drainage, and if you've ever had it before, you will see the lightness of your being once you've done lymphatic therapy.
So Liz, I have
Natasha and Anita both do it.
one last one, and Liz and I'm
And
going
they're
to try to
amazing practitioners. And Natasha and Anita, if you haven't experienced them, they are healers in and of themselves.
So one had a brother who had parasites and died of cancer. Is there any kind of relation to that? Okay.
Absolutely.
He was in
Just-
the jungle and he had a job in the jungle. In the
I
deep
ask
jungle.
everyone, just Google parasites and cancer and they'll find more. They won't have enough time in their lifetime to read all the information.
Okay, I think that's it, gang. We know that you have a lot of questions still coming. We are going to have Dr. Connealy on again, I promise. And please mark your calendars for March 7th and info@cfnmedicine.com on any unanswered questions, okay? And we'll try to get those answered within the week. Thank you so much.
With parting words to all of my beautiful, wonderful patients that I have here, I want to thank you for being part of my journey and my mission, because as I always tell every patient, your problem serves your purpose. And I know every person here is trying to help someone else. I know it, and because I know all of my patients. And I need all of you to do what my patients get to do every day with me. And you can help spread this vital information to everyone. We can change the world together.